Hi, I want to talk about bipolar disorder. Do you have a family member or someone close to you that struggles with bipolar disorder? When they go from extreme highs, irritation, lack of sleep, everything they do on the high when they're in mania is to the extreme, and that can be food, sex, going out, drinking, drugs, everything to the next level. And then we have the other side of it, where it's the depression side, where it's isolation, it's constant sleeping, it's not wanting to do anything, sadness and depression, right? And at times as a family, it can be very challenging to, see your loved ones going through this. I'm going to offer you some healthy tips to, hopefully navigate you through the process a little easier. For starters, the number one thing a family member needs if you're dealing with, a loved one with mental illness is that you make time to take care of yourself. That is very important. I know I just feel guilty when I take care of myself. I feel guilty when I push that aside, because self-care is the only way you can keep going and supporting your family member in their process. 2, create a crisis intervention plan with your loved one when they are stable and when they're on their medications or whatever it is that they take to manage their mental health. You do it when they're in a good place because you want them included in anything that you do to build that trust. So the first, on the crisis plan, you want to have a list of family members who are going to support you in this, names and phone numbers, who you can call if you need support or if you need backup, if you need help with trying to locate your loved one or anything of that nature. 2, you want to have the crisis intervention line on that list, the 988 if you're in the Philadelphia area, 911, and any other crisis numbers that your loved one may want to add. Also ask them what hospitals do they prefer to go to. A big thing with a lot of mental health clients is sometimes they have very bad experiences at certain hospitals and they don't want to go back there. So if they do go there, they're not navigating to get the help because they do not want to be there. So they're going to fight against the rebel, basically. So you want to know what hospitals that they're comfortable with going, what doctors and situations that people that they're okay with including in their treatment. 3, create a list of, I want to say, behaviors or things that you see that they notice about themselves when things are starting to go bad for them. You want to add your things of what you see on the list, and that is for everybody in the beginning to have as well, so they're aware if something's not looking right. We can be proactive. We can try to intervene before it gets to the point where we're in crisis mode and we have to call the crisis line, we have to take them to the hospital and all that stuff, right? So you want to get a list of those triggers, whether it's avoidance, whether it's you see them starting to overdo something all of a sudden that they wasn't doing before. When you see these things, you can jump in and be like, hey, how you feel? Ask some questions about where they are on their medications. Did you take your medicine? You want to keep it very light. You want to keep it like just concern, nothing tragic, but you want to make sure you want to see where they are, right? Lastly, like I said, what interventions are they comfortable with? Who was their safe place? Who are the people that they feel comfortable with when they are in crisis? It's very important because trust goes a long way. And if they don't feel trust, they don't feel concern, they're paranoid, they're detached, they don't want the support. So you want to surround your loved one with people who can really support them when they're in their time of need, and have access to all the information for all their supports at hand at any given time to help your family rally around your loved one. Thank you and have a great day.